Good evening. I'm psychiatrist Jay Fawver, live from Fort Wayne, Indiana. Welcome to Matters of the Mind. Now in its 27th year, Matters of the Mind is a live call-in program where you have the chance to choose the topic for discussion. So if you have any questions concerning mental health issues, give me a call in the Fort Wayne area by dialing 969-2720, or if you're calling any place coast to coast, you may dial toll-free at 866-969-2720. Now on a fairly regular basis, we are broadcasting live every Monday night from our spectacular PBS Fort Wayne studios, which lie in the shadows of the Purdue Fort Wayne campus. And if you'd like to contact me with an email question that I can answer on the air, you may write me via the internet at mattersofthemind, all one word, at WFWA.org. That's mattersofthemind at WFWA.org. And I'll start tonight's program with a question I recently received. It reads, Dear Dr. Fawver, can we cure depression? I've done well the past few years, but I wonder about depression coming back. I'm in a new relationship and I have a new job. I'd like to figure out ways to make me move beyond this, I presume, being the potential for depression. The more episodes of depression you experience, the more likely you can have a recurrence later on. And the general rule of thumb will be 3 strikes and you're on. That means that if you've had 3 or more episodes of depression lasting for at least 2 weeks, you probably need to be on an antidepressant ongoing, otherwise you'll have a 90% chance of relapsing. But the good news is we do have some newer medications coming out for the treatment of depression, among which have been ketamine, S-ketamine, also known as Spravato, and a more recently one called Auvelity, which gives you high doses of dextromethorphan. The bottom line is those particular medications will affect a whole different chemical that we've been focusing upon for the past 6 decades, that chemical being a neurotransmitter called glutamate. Glutamate seems to rapidly increase the fluffiness of the brain. And here's what happens. When you get depressed recurrently, your brain neurons become less fluffy. And it's like a tree in your backyard that's getting kind of shriveled up, and instead of having 30,000 little branches on it, it only has 20,000 branches. That's what happens to your brain when you have ongoing depression. Your brain literally starts to shrivel up. It's not that the neurons are dying off, it's just that your branches are getting less fluffy. What do you do when you see a tree that has fewer branches? You tend to give it some fertilizer. And that's what the neurotransmitter glutamate can do. If you can enhance glutamate transmission, you can basically make the little neurons more fluffy. We call it gluconeogenesis, and in helping somebody with neogenesis, what we're trying to give them is the ability to get more fluffiness in the brain itself. So the possibility will be there. If we can make the brain fluffy enough, you'll have less of a likelihood for recurrence with depression. But in the general rule of thumb will be if you've had recurrent depressions, especially if they're really severe and they gave you a lot of difficulties such that you lost your job, you had trouble with relationships, or you even made a suicide attempt, those kind of depressions, were very hesitant in having somebody stop their medication or stay off of it. You're in a position where it sounds like you're not taking medication for depression now, you're doing all right, but you're noticing that you have some stresses coming up. Now, stresses are great if you can tolerate them. We expect stresses in our lives. We want stresses in our lives because stress makes you stronger. Stress is basically a means of a change in your day-to-day situation. So a new relationship can be a stress. A new job can be a stress. That's great if you can cope with it. So what makes people have difficulty with tolerating stress? Past life experiences, difficulty with coping, other things going on in their lives. So you have to take that all in consideration. So now we're looking at this whole phenomenon called stress resilience. Stress resilience is basically defines your ability to put up with stuff. So with better stress resilience, you'll be able to deal with stress better, and that's what we're really hoping now. So there are some scales that we're actually using as questionnaires to determine how stress resilient somebody might be. So no longer are we simply asking people about their sleep and their crying episodes and their level of sadness and their concentration. We're now starting to ask people about their abilities to put up with stuff better and to be able to be more resilient to changes occurring, because that's normal if you can put up with things, if you can be flexible when the stresses happen. That's normal and that's good. If you don't go through a lot of stresses in your life and you don't have a lot of things that are changing in your life, sometimes that can make you more prone to depression when something bad does happen. They did studies of soldiers who had post-traumatic stress disorder. The ones that had more PTSD in combat were the ones who had fewer life experiences that were stressful compared to the ones who did have life experiences that were more stressful. So stressful life experiences can in many ways make you stronger. So what do you do now? You've got a new relationship, you've got a new job. Keep an eye on your sleep. Keep an eye on your ability to make good decisions. Keep in mind that if you're having more trouble with anxiousness and anxiety and worry, those can all be precursors to getting depressed. And by all means, you can always talk to your primary care clinician, or if you have a mental health clinician available, keep in contact with him or her for the purpose of determining if you need to go back on an antidepressant, if you need to increase your psychotherapy, whatever needs to be done. Thanks for your email. Let's go to our first caller. Hello, Julie. Welcome to Matters of the Mind. Julie, you want to know if there's any depression medications that make TMJ, temporal mandibular joint, worse. TMJ is basically where you get a tightening of the jaw, and bruxism is the term for the tightening of the jaw, but TMJ is up here at your joints where the jawbone connects to the skull. And if you have bruxism, you can get worsening TMJ. The medications most commonly associated with worsening TMJ will be medications that are enhancing serotonin. The ones that are primarily used in those situations will be Lexapro, Celexa, Paxil, Zoloft, and Prozac. Luvox can be used as well. Then you have the serotonin norepinephrine reuptake inhibitors such as Fezima, Pristiq, Effexor, and Cymbalta. So any of those medications can sometimes make TMJ worse, Julie. You'd notice it by more grinding of your teeth. Bruxism is the term that's often used for that. Often dentists will notice that you might have a little breakdown of enamel if you're clenching your jaw, particularly at bedtime, but that will make TMJ worse. What do we do in those cases? We typically will try to get somebody over to a non-serotonin or a limited serotonin type medications, medications that might affect more dopamine, norepinephrine, or I mentioned before, a medication that affects more glutamate, and in doing so, you get away from the serotonin side effects. But enhancing serotonin, Julie, can sometimes increase the likelihood of having jaw tightening and TMJ. Julie, thanks for your call. Let's go to our next caller. Hello, Lewis. Welcome to Matters of the Mind. Lewis, you want to know about the connection between the brain and muscle testing. When someone pushes one area of the body and get a different response in another part. I'm not really clear what you're asking there, Lewis. If somebody presses on one part of the body and you get a different response in another part, I'm not sure where you're going with that, but what I can tell you is the left side of the brain affects the right side of the body. The right side of the brain, over on the right side on this little strip here, that'll affect the left side of the body. And if somebody has a stroke on one side of the brain or another, it will affect the opposite side of the body. So that might be to what you're referring. There are tests called electromyograms that look at muscle twitchiness, and they look at the ability to fire nerve impulses in certain parts of the body. And the left side of the brain will affect the right side of the body. The right side of the brain will affect the left side of the body, at least from the neck down. Lewis, thanks for your call. Let's go to our next email question. Our next email question reads, Dear Dr. Fawver, are cigars addictive in the same way cigarettes are, and what are the ways to quit cigar smoking? I think it depends on the frequency and the amount of cigar smoking to which you're referring. Cigars have a high potency of nicotine, but people don't usually smoke cigars to the degree that they will cigarettes. Now, cigarettes, you tend to inhale the smoke. It goes to your lungs. People will sometimes smoke 1 pack, 2 packs, 3 packs, or more of cigarettes. And in doing so, they're taking deep inhalations to get that nicotine. And they're smoking throughout the day, often every 2 hours, because if they don't, the nicotine drops very abruptly. And in doing so, the nicotine can put you into withdrawal as it's getting out of your system. With cigars, people will often smoke them in such a way that it's mainly going to be affecting the absorption in their mouths. So people smoke cigars in different ways than they will smoke cigarettes. So even though cigars are more potent with nicotine, people usually aren't smoking one cigar after another, after another, after another. Now, the dangerous of cigars will be that you're inhaling the cigar smoke, which has very potent nicotine content in it, into the mouth and into the throat. And that's where Sigmund Freud, who is he was a frequent cigar smoker, he died of cancer in his throat. So you can have difficulties related to cancer in the mouth and throat that can give you problems with cigar smoking in a different way than cigarette smoking, which will often give you more difficulty in the lungs with emphysema and bronchitis and other respiratory related issues. But from an addictive standpoint, I would say for most people, cigarettes are probably more addictive because you're having that ongoing stimulation of nicotine into the nucleus accumbens part of the brain. So as I take the brain apart, nucleus accumbens is kind of in the middle part of the brain. That's the part of the brain where nicotine is stimulating, and in doing so, it's firing out all this dopamine. Dopamine makes you feel good, makes you feel relaxed, helps you concentrate. So many people will use nicotine as a means of really firing up that area. If you're kind of marinating that area all day long with nicotine, it causes you to want to keep coming back for it. And dopamine is indeed the chemical that draws people back with addictive behaviors. Thanks for your email. Let's go to our next caller. Hello, Mark. Welcome to Mayor's Mind. Mark, you had mentioned that you have issues finishing projects. You just can't push through. Is that a sign of adult ADHD? Mark, I'd want to know how long you've been having difficulty finishing projects, because if it's only been in recent years and let's say you're in your 30s, I'd say it's probably another factor, and I'd want you checked out for various other medical conditions. Other medical conditions in psychiatry that we're often assessing will be, right off the bat, sleep apnea. If somebody has difficulty with snoring, they're pausing in their breathing at night, they're not getting enough airflow to their lungs at night, thereby not getting enough oxygen to the brain. Sleep apnea will indeed give you difficulty with concentration, focus, motivation, initiative, and perseverance the next day, because you'll have trouble with getting enough oxygen to the brain at nighttime. So that'll give you symptoms of ADHD in some cases, especially the inattentive symptoms. Depression, if somebody has depression day by day, one of the key symptoms they'll notice will be difficulty with the speed of processing. It's like having slow computer speed in your brain, so you'll have trouble with speed of processing. So with computers, there are these little mechanisms that they're called CPUs that really enhances computer speed. You have the same ability in your brain, and when you have clinical depression, your computer speed in your brain will significantly slow down. We'll often look for other medical conditions like thyroid conditions, diabetes, low iron for some people. For instance, if you have a slow gastrointestinal bleed, that'll give you low iron. Sometimes kidney or liver problems can give difficulty with concentration. But if you're having trouble pushing through, as you mentioned, that is called perseverance. And difficulty with perseverance is a symptom of attention deficit disorder, but by definition, attention deficit disorder needs to start in childhood. Yeah, it can affect you in different ways as you go through life. If you're more academically or occupationally challenged, you might have a noticeable difficulty with concentration on things that aren't that interesting later in life, and you didn't notice that problem earlier on. So we always have to consider those type of factors. But with attention deficit disorder, typically it's a day-by-day difficulty to some degree, not unlike nearsightedness. If you have nearsightedness, you don't have good days with your vision and bad days with your vision. Every day is pretty bad, and you need corrective lenses for the nearsightedness. That's what people will often need for attention deficit disorder. If the ADD is bad enough, causing functional impairment, giving you difficulty socially, occupationally, academically, you bet that's where treatment can be helpful. Thanks for your call. Let's go to our next caller. Hello, Benjamin. Welcome to Mayor's the Mind.
Hey, doctor. How you doing
Hey,
tonight?
Benjamin. Doing all right.
I was wondering, this topic's a little off from what you were talking about, but marijuana smoke, you were talking about cigar smoke. Can you name some long-term negative effects of marijuana smoke, as well as maybe does it cause attention deficit disorder? They now have little pouch things that are plastic you can pull out and take a whiff in public and blow it out, and nobody even sees smoke, but yet people are trying to gain some type of high in things. I know all that stuff, opposed to what the Lord had planned for man, is not on the right track. So what do you think? I'm going to hang up. Thanks.
Okay, Benjamin. Thank you for your call, because that is very relevant to what we're discussing. With marijuana smoke itself, it was thought years ago it would be more hazardous to the lungs than cigarette smoke or cigar smoke, and it was not found to be more hazardous to the lungs. And the thinking was, well, maybe it's because people don't use marijuana all day long like they will cigarettes. People will often chain smoke cigarettes, so they're always getting exposure to the smoke to their lungs. So maybe it's a dose type of issue with marijuana smoke itself. My biggest issue concerning marijuana, Benjamin, is that its effects on the brain. If you're under 24 years of age, it has been shown to suppress the white matter growth of the brain. What that means is basically it's suppressing your insulation of the individual neurons. The individual neurons have this insulation on it, and it's called white matter, and it allows the communication from one part of the brain to better send electrical transmission to another part of the brain. And if you are using marijuana, what we do know with certainty, looking at MRI studies, and this has been studied for the past 20 years now, you're going to have less white matter development, and that can be permanent. So right off the bat, Benjamin, I'm always telling people, if you're under 24 years of age, because that's when the brain is still growing, you definitely don't want to use marijuana. You can have irreversible suppression of brain volume if you do so. Now, how about if you're over 24? That's been controversial, but about a couple of years ago I did see a study that people even in their mid-30s who were using marijuana for the first time did indeed have some difficulty with cognition. Now, what kind of difficulty with memory, concentration, and attention span you're going to have? Usually it's initiative. A lot of people will notice when they use marijuana they have less motivation, less initiative, less willingness to get stuff started. So people using marijuana will have some symptoms of attention deficit disorder where they won't be able to concentrate, they won't be able to pay attention, but they'll have trouble getting things started and maintaining initiative, and they have trouble with perseverance getting things done. So the thing about marijuana that people like, Benjamin, is that it makes them not care. And I'm always warning these young adults going off to college, don't start using marijuana or continue using it if you're already using it. Don't start using it or continue using it when you go to college, because it'll make you not care. It'll make you less stressed out about the academic challenge you might be experiencing, but it'll make you not care. And that's why many industries will screen their employees for marijuana, even in states where it's legalized. They don't want you using marijuana on the job because it makes you less productive as an employee. And with my coworkers, I wouldn't want them using marijuana because they just won't care. It'll make them less stressed out. They'll feel less anxious. And THC is the active ingredient in marijuana, as well as many other chemicals in there. But THC is what people like because they get a high. They get a nice, pleasurable effect from it in many cases. But it does affect the brain development, especially if you're younger. And a big issue that I see with marijuana, Benjamin, will be not that it causes everybody to get psychotic, but if you have a family history or if you have a propensity of your brain to get psychotic, it can significantly increase the likelihood that you will get psychotic. And we could possibly significantly decrease the incidence of a condition called schizophrenia if people didn't use marijuana in their adolescent and early adult years. I always wonder, how many people out there wouldn't have developed schizophrenia if they didn't use marijuana as a trigger. So it's something that can kind of spark the fire of schizophrenia when it might not have developed otherwise. But my bigger concern about marijuana across the entire population right now, Benjamin, is that it does cause you to have trouble with attention span. It's thought to decrease the IQ potential of somebody if they start using it on a regular basis. What I will see, not uncommonly, if somebody started using marijuana when they're 13, 15, 16 years of age, it seems like their emotional maturity stops right there, because it's normal and it's expected to feel socially anxious when you're an adolescent. So when you're going through your teenage years, you bet you're supposed to be socially anxious. You're supposed to feel awkward, and you got to get over that. If you're using marijuana at 13, 14, 15 years of age, you don't care. You just get through, and you don't develop those coping mechanisms as an adolescent that you need to get through those awkward years. And here you are, you're still using marijuana in your 20s. All of a sudden, you're in your 30s for whatever reason. Your spouse, your children, for that matter, might ask you to stop using marijuana. You try, and you have trouble with emotional maturity. You haven't developed the coping techniques to be able to overcome some of the type of stresses people will have been able to learn in which to cope when they're adolescents. So it does tend to stunt not only brain growth, but also I think it stunts emotional maturity quite uncommonly. Thanks for your call. Let's go to our next caller. Hello, Lewis. Welcome to Matters of the Mind.
I wanted to clarify what I asked about before. Muscle testing, where someone will
thank you, Lewis.
Push down on your arm, and then you think about certain things, and when something triggers, you get weaker and stronger depending on what you're thinking about.
I'm not familiar with that technique, Lewis. I am familiar with some techniques where you can press, and it's a technique used with acupuncture, where people will use acupuncture needles and they will push the needles in certain areas when they're stressed out in certain ways. For instance, you can press an acupuncture needle on your ankle and get stress relief in that way. So I think what you're referring to is the technique of acupuncture for the purpose of relieving anxiety, and that is legitimate. It's not used a lot in the United States, but it's used over in Europe, especially in England, where acupuncture can be used specifically for that purpose, for muscle relaxation and sometimes even for relief of anxiety. Lewis, thanks for your call. Let's go to our next email question. Oh, we have another caller. Hello, Peggy. Welcome to Matters of the Mind. Peggy, you'd mentioned that you have uncontrollable crying and you wonder if it could be related to you're having a stroke. Is there anything you can do about it? Well, Peggy, I'm going to presume that you've had a stroke in the past. And when you've had a stroke in the past, you bet it can give you difficulty with crying for no reason. We call it pseudobulbar affect. Pseudobulbar affect, also known as PBA, is a condition where the front part of your brain kind of isn't regulated by the other parts of the brain, and you have emotional difficulty to control with crying, laughing. You can have irritability in some cases. It's basically because the front part of the brain, which regulates the emotions and your ability to maintain impulse control, it's not working so well. So if you have had a stroke in different parts of the brain and they're affecting how the front part of the brain is able to work, that can give you something called pseudobulbar affect, and there are medications that can be used for pseudobulbar affect depending on what type of symptoms you have, but it's a real phenomenon and it can come across as uncontrollable crying for some people. Now, historically, Peggy, we've used medications that simply increase serotonin. I mentioned them earlier. Celexa, Lexapro, Paxil, Zoloft, Prozac, Luvox. These are medications that all increase serotonin, and in doing so, they dampen the emotions. If they dampen the emotions, you'll have less crying. But anymore, we're using other medications like Nudexta, we're using medications like lamotrigine. These are medications that affect glutamate, and in doing so, they dampen down the excessive glutamate that's released when people have difficulty with stroke. So when you have a stroke, you have excessive glutamate release, and that can cause you to have more moodiness in some cases. So a medication like Nudexta, for instance, will regulate that, as will a medication like lamotrigine. Peggy, thanks for your call. Let's go to our next caller. Hello, Dawn. Welcome to Matters of the Mind. Don, you want to know about the science behind hypnotherapy for panic attacks. You've been doing hypnotherapy and your panic attacks have remitted significantly and your results have been great. That's fantastic, Don. What I think you're doing there with hypnotherapy, you're allowing yourself to get more relaxed. And if you're more relaxed and you have less anxiety, you're less prone to having a panic attack. In other words, there's something called anticipatory anxiety that kind of leads up to difficulty with having a greater likelihood for panic attacks. So if you can use hypnotherapy as a relaxation technique, and I've used hypnotherapy myself, Dawn, on myself. You can do self-hypnosis. You can learn how to do that. It's a very effective tool. I did it 30, 40 years ago to help me with anxiety and help me relax before I get on live television. I mean, there's ways you can put that to effect. What you're doing there is you're chilling out this front part of the brain over here called the amygdala. The amygdala is at the tip of the thumb. The brain's kind of shaped like a boxing glove, and at the tip of the thumb is the amygdala. Yeah, when you're using hypnotherapy, you're calming yourself down, you're relaxing your whole body, and in doing so, you're going to be less prone to having panic attacks. So that's the main reason why hypnotherapy for you is probably helping with the panic attacks, because you're dialing down your anxiety volume control, and doing so, you're making yourself less prone to having panic attacks. So I congratulate you on that, Dawn. Keep it up. Let's go to our next caller. Hello, Joni. Welcome to Matters of the Mind. Joni, you want to know, does eye movement and desensitization reprocessing, EMDR, contribute to neuroplasticity? I mentioned neuroplasticity earlier, where it's making your neurons more fluffy. It might to some degree. And the reason I say that, Joni, is because I think a lot of psychotherapy techniques indirectly and very gradually do help with brain development. In other words, if you're less stressed out, if you're coping with life circumstances better, I think it is going to allow natural fertilizer, it's called brain-derived neurotrophic factor, BDNR, to be released. What these medications that are affecting glutamate are doing is they're doing so very, very quickly within a matter of hours. But EMDR, psychotherapy, counseling, when those techniques are successful, it can have a reversal on your brain's fluffiness in a good way, and that can be beneficial for you. Joni, thanks for your call. Unfortunately, I'm out of time for this evening. If you have any questions concerning mental health issues, you can write me via the internet at Matters of the Mind, all one word, at WFWA.org. I'm psychiatrist Jay Fawver, and you've been watching Matters of the Mind on PBS Fort Wayne, now available on YouTube. God willing and PBS willing, I'll be back again next week. Thanks for watching. Good night.
Preceding program on PBS Fort Wayne was made possible in part by
Cameron Psychiatry, providing counseling and care for those that may struggle with emotional and behavioral challenges. More information available at CameronMCH.com.